Well, since the topic came up the other day about removal of medications during plasma exchange, thought before we start afternoon care conference, we'd chat a little bit about it, okay? I'm going to blow through a whole bunch of slides because this is a talk that I put together for the PharmDs. So there's a whole bunch of stuff for them explaining what is plasma exchange. So
I might need that.
I'll ask the question. Do the two of you feel comfortable that you understand the concepts?
Yeah.
Yeah, I haven't started plasma
Okay.
exchange.
We'll go ahead and go through those, and then we'll get to the part where it's important, okay? Okay, so there are a couple of things that we can talk about with regard to medications and plasma exchange, okay? So the first few slides, I want to talk about two specific issues. The first is ACE inhibitors. So one of the things that we have the resident for all apheresis procedures is the patient on an ACE inhibitor, an angiotensin converting enzyme inhibitor. These are medications that are used to treat just about everything that ails you, to be quite honest with you. They are given to people post myocardial infarction. They're given to people who have congestive heart failure. They're given to diabetics who have increased protein excretion from their kidneys, from their diabetic nephropathy. They're given to a lot of people. Now, the issue here with regard to plasma exchange and angiotensin converting enzyme inhibitors, the reason why we ask is this, that bradykinin is activated to something called bradykinin by another substance called prekallikrein activating factor, and that is present in some lots of albumin, okay? So it's variable from lot to lot. What that does is the bradykinin is converted to bradykinin. Bradykinin is a very potent vasodilator. So it causes the blood vessels to dilate up, and will cause people's blood pressures to tank, okay? Usually bradykinin is rapidly metabolized by kinase 1 and kinase 2. And it has a half-life measured in fractions of a second. So it's very quickly metabolized by the body. But if you are on an ACE inhibitor, okay, you inactivate those two enzymes, so you cannot metabolize this bradykinin. And so the result is, as soon as the blood starts coming back out of the centrifuge, it's mixed with the albumin, the prekallikrein activating factor converts the bradykinin into bradykinin. As soon as that blood comes back in and hits, okay, patients may experience profound vasodilation. So suddenly, if you think about it, the size of the bottle gets bigger, but the volume of the fluid in the bottle stays the same, right? So the size of the intravascular space gets bigger, but the amount of blood stays the same. So they can experience profound hypotension. They can experience bradycardia. They will frequently have flushing. Usually it starts at the top of their head down to their mid-abdomen. They may become very short of breath. I've also seen cramping, abdominal pain, and some diarrhea that will occasionally occur in these people. If you stop the procedure, which is what you need to do, then usually in short order the symptoms resolve. If you restart the procedure, it comes back, okay? So basically, once somebody has one of these reactions, that's it for the day. We're done with that plasma exchange procedure. Now, an important concept here is this, that the prekallikrein activating factor varies between lots of albumin. So there's no guarantee, okay? There's no guarantee that this will actually occur if somebody's on an ACE inhibitor. So it's pretty hit or miss, because it's going to be variable depending upon the manufacturer of the albumin, the lot of the albumin, all the rest. So we ask about it, and if it's a non-emergency procedure, okay, we will ask the service to hold the ACE inhibitor for 24 to 48 hours. Usually we just say, don't take it that morning, take it after you're done with the plasma exchange, okay? But if it's an emergency procedure, okay, so somebody we need to treat right away, that doesn't mean that we're going to wait 24 to 48 hours, okay? We'll go ahead and do the procedure because, to be honest with you, it is unlikely to occur. But knowing that the person is on an ACE inhibitor, we're aware of it, we can look out for it, okay? There's another medication called angiotensin receptor blockers, which can be substituted for angiotensin converting enzyme inhibitors. This reaction does not occur with the ARBs, the angiotensin receptor blockers. So switching somebody from an ACE inhibitor to an angiotensin receptor blocker is okay. Now again, this is in the albumin. So if you are treating somebody on an ACE inhibitor with a plasma exchange, and they're getting plasma as their sole replacement fluid, okay? We don't care. We don't care, because it's plasma, it's not albumin. So there was an instance, I think I was at the AABB meeting in Montreal, there was a TTP patient who was getting 100% plasma, so they weren't getting any albumin, okay? Okay? They were on an ACE inhibitor, and the primary service and the resident were like, oh, we can't treat him. Well, you know, TTP can kill somebody pretty quickly, right? So, number one, it's an emergency procedure, so even if we were using albumin, we would have gone ahead. But number two, we were using plasma, so we're not concerned about that, okay? Now, very uncommon, very few of these have I seen with plasma exchange. Where you do see these reactions is in our friends who are undergoing LDL apheresis. Those columns, the LDL columns, that their plasma gets pumped through, generates lots of bradykinin. Those patients, if they come in and tell you, I forgot and took my ACE inhibitor, don't even bother hooking them up. Okay? Just, that's it for the day.
So what is it, the saccharose that's doing it? Breaking
Yes,
it down?
it's the negative charge of the dextran sulfate.
Oh, it's the
So it's the negative charge is what generates this in those columns. Okay? So, yeah, if they tell you, if they come in, if you ever get anybody, we've had some of our patients occasionally forget and take it, and they've either A, not told us, or B, insisted that we go ahead and treat them because they didn't want to come back and reschedule.
Yeah, it's 100%.
It happens, it's bad.